Now, June 14th marks World Blood Donor Day, and there are several issues surrounding this topic, such as the storage of blood, the cost of blood, and the utilization of it as well. NTV's Helen Aura is following up this story, bringing us the key concerns around blood donation and how Kenya is celebrating this day. She joins us now live from Uhuru Park. Helen, what can you tell us?
Smiths, Kenyans are streaming in, still one at a time here to Uhuru Park to donate blood. And for some, this is not a first-time event, as others have been doing it year in, year out. And the theme for this year is Give Blood and Keep the World Beating. Well, according to the Kenya National Blood Transfusion Services, COVID-19 has indeed affected the levels of blood in the blood banks. And from earlier on this year, actually earlier on in 2020, Kenya has been recording a series of low count with blood in the blood banks of the country. And some of the key issues actually that have surrounded this particular issue is the gross mismanagement at the Kenya National Blood Transfusion Services, which earlier on the health CS, Mutahi Kagwe, had actually addressed this issue, with issues surrounding such as selling of blood to our neighboring country, Somalia, a case Mogadishu to be specific, the city to be specific. And I'm joined by the CEO of Kenya National Blood Transfusion, Mrs. Nduku. Maybe she will tell us more about the event. Welcome. For today's event, what is the exact target? I understand it's a 3-day event. How many pints of blood are we looking to get by the end of this?
So thank you. 14th June is the World Blood Donor Day. So this event is not just being celebrated here, but it's being celebrated across the entire world. We intend, our target is 12,000 units over the next 3 days across the more than 44 blood collection sites happening all over the country in the different counties.
And I also understand, as a country, our target is to get at least 500,000 pints of blood in a year. And right now, due to COVID-19, the numbers have kept on dipping and dipping and dipping. How realistic right now is this target, or has it changed?
So let me start with saying the numbers have not been dipping and dipping and dipping. What has happened is that the numbers did dip, especially the first 6 months of COVID. And what we have seen is that this year we have had more and more drives. We had the Valentine's drives, the International Women's Day drive, the Border Association drive, and we are seeing more and more Kenyans coming out and giving blood. So the reality is that if you compare, for instance, the quarter October to December 2020 and January to March 2021, what you find is a 200% increase from about 23,000 to 63,000 units of blood. So what it means is that we are actually seeing more and more. We are getting back to where it should be. Now, has the target changed? That target is based on need. We do need a minimum of 500,000. Are we going to meet it this year? Because of COVID, not this year. But given the progression that we are making and the trajectory we have taken, we are confident that surely by next year when we are having this same event, we'll be able to say, actually, this is a progress we have made and this is how much we need.
There were lots of claims that have marred the Kenya National Blood Transfusion Services, and especially transparency being one of them, and the service being accused of not being transparent in the activities, hence Kenyans, with some of them withdrawing from donating blood. Maybe could you tell us how far we are, the strides that we've made as a service? And because I understand from PS Mochacha, she'd mentioned there are plans of making it a state corporation as well, because I know they're quite big shoes to fill, but maybe just give us a brief where we are right now.
So thank you very much. I think I'll start by saying that when the Cabinet Secretary spoke about the service last year, he said we were going to have changes, there was going to be transformation. And obviously the first thing was to have leadership changes and management changes in the entire management of the institution. And as I joined the institution as part of beginning to help this institution reform, and that was in November last year. And so in terms of then once you have the management and leadership changes, then what is the next thing that we need to be doing? We need to be looking at our systems, because it's not just the people, it's also the systems. And we have looked at our systems and made various changes. For starters, I think I have said this over and over again, we are now looking at developing a vein-to-vein system, which means a track and trace system basically. And where are we at? It is a 3-phase approach. phase one has been internally. Can we just have an IT-based, web-based, technology-based system that we are able to say what was collected, what was issued, and where was it issued? Let's start there as basic accountability. The second part has been then going to have an inventory management system for the supply chain, and that is what we are rolling out. And then we'll be looking at a more system that all facilities, blood collection establishments, private, public, county, mission will be plugging into. And that's the direction we are going to deploy over the next 6 to 8 months. Thank you.
Well, thank you so much for that, Dr. Nduku. Well, Smith is indeed so much transformation that Dr. Nduku has indeed spoken to us about. And one of the key things is the upscaling of the ICT center to be able to trace where this blood goes immediately from the donor up until the patient receives this. We'll bring you more by the day as the day goes by. Back to you, studio.
All right, Helen, thanks very much indeed. NTV's Helen Ara coming to us live from Uhuru Park on this World Blood Donor Day.